I'm Philippe Amouyel. I'm professor of public health in France. I'm affiliated and CEO of the Fondation Alzheimer and working also at the university and hospital. My task in this conference is just to present what we could expect from a personalized medicine in the field of neurology. One of the points of neurology is that we are desperately lacking treatment. So before personalized medicine, we need a bit of treatments, but we have to prepare that now, just for example, about diagnosis. And to do this, we need to have some different element and structuration just to speed up and take example from what has been done in cancer. Today, to make great discoveries, you need two things: researchers and money. At the level of only one country, you cannot achieve enough researchers or enough money. So you need to have international collaborations. That's what I tried during the last 15 years. I chair the Joint Neurodegenerative Research Programs initiatives from the European Commission, JPND, and with that programs, we arrived to collect more than 250 million euros and make about 1,500 teams working together. And with that, we developed a lot of things. We had incredible results, we had patents, we had innovation. So the only way to do this in any field, from my point of view, of course, neurology is important, but all the fields need to do this, is to work together. At the level of Europe, at least. So definitely, personalized medicine or not, we need to work together. I think in Europe, we have a lot of advantages, but we have to fight against our old divides. And for instance, we are a sum of countries. We need to become a federation or something like that of countries. I think one of the first key points is to reintegrate UK in Europe. I think this is very important if we want to speak about Europe. The second is to follow up what we have done on JPND, Neuron, and other European initiatives, is the defragmentation, that countries putting money in a virtual pot together just to increase our capacity to fund new discoveries. The third point is about data. And it's really a key issue because indeed we are very well protected with GDPR in Europe, but it's very difficult to work together within the European countries because the level of GDPR is a bit different from each country. So the idea could be to build up a sovereign cloud from Europe where any European country signing off in the European community could put her data, medical data, personal data on this sovereign cloud, protected at the level of Europe. And this will speed up clearly the research. The last point, of course, is to increase the budget. In the field of neurology, for instance, we have in preparations, after JPND, Neuron, and other initiatives, a brain partnership, a European brain partnerships with some money, but probably not enough to compete with US or China or the big continent. So we need to become a research continent.